Welcome to the Coming Home Well podcast, the show that educates, supports, and advocates for the veteran community. Your host, Dr. Tyler Piron, U.S. Army retired, will bring you exciting conversations with amazing guests about resources, research, and military history, all geared to helping our warriors to come home well. Here's your host, Dr. Tyler Piron.
Welcome back to Coming Home Well. I'm your host, Tyler Piron, and today we're going to talk about something we haven't talked about at all. It's the whole health approach. And so I'm asking, what is that? How do you get into it? What does it really mean? And I had to do some research, and I said, this is awesome. I'm very much into holistic health. You got to look at all the things that are around you in order to be well. And that's what we talk about at Coming Home Well is, what do you do? How do you get that support? How do you find that purpose? How do you find that thing after you get out of service? Well, it's not just healthcare. The VA does a lot of things, and it's not just going to the doctor and getting a pill. There's a lot of other things that they're doing. And so we have Meghen Erboe. She is from the Richmond VA Medical Center, and she is the clinical director for the whole health approach or offerings over at the VA Center here in Richmond. Thank you, Meghen, so much for joining us on Coming Home Well.
Thank you for having me. I'm excited to be here.
So let's go at the very beginning. What is whole health?
Well, I loved how you introduced it because so many people get confused. Is it a program? It's a department? Is it services? What is it? And whole health is truly a system of care. And what we're trying to do is we're trying to create a cultural transformation throughout the Veterans Health Administration to create more of a healthcare system instead of a disease care system, where we're wanting to focus more on what matters most to the veteran, bring more focus and awareness to empowering them and equipping them with self-care practices to where they can build up more of their own foundational skills to create more health and well-being.
So what does that translate to? Because that's a lot of words. And I think it makes sense to me. Like, it's not just going to the doctor. It's like being healthy in all parts of your life. But what does that look like? How does that happen?
So again, thank you. So when you come into the VA, of course, you're still going to connect to your primary care doctor. And what we are moving towards is having the doctor, again, ask you what matters most to you about your healthcare visit today. How can I help you? And so it's going to be a combination of bringing in, of course, their clinical awareness and experience into the clinical visit because they have items and agenda that they have to go through with you, but also identifying, what matters most to you. And maybe there's some self-care practices where we could offer some well-being groups to maybe help improve sleep, maybe improve relaxation techniques such as meditation or yoga or Tai Chi. Those are some things that we can offer through the whole health system of care.
So it's not just medical care. It's sort of, hey, you can also do these things on your own. Sort of, mindfulness and relaxation and stress management and all those things which contribute often to less than ideal outcomes.
Yes. The base mission of whole health is to empower and equip veterans and everyone to take charge of their own health, life, and well-being.
So sort of putting the ball back into the veterans court saying, hey, what's important to you? And it may be the fact that you have some medical issues, but that's only part of the puzzle.
Yes. And again, they'll be engaging with their doctors, maybe refer to specialty care clinics. But again, all of their visits can be grounded in to that question of what matters most to them. And then whatever goals that they come up with is connected to what matters most to them. And besides the regular conventional care treatments that we can connect them to, We can connect them to complementary integrative health therapies such as yoga, tai chi, clinical massage, acupuncture that can complement their regular everyday care.
Now, I'm no medical professional. What are complementary integrative care? You mentioned a few of those. How does that work in the VA system?
So it's complementary integrative health modalities. So the VA recognizes 8 CIH or complementary integrative health modalities that is now part of our Veterans Health Benefits Package. And so those that I mentioned, the yoga, the tai chi, the meditation, biofeedback, acupuncture, clinical massage, guided imagery, and clinical hypnosis.
The fact that you know them all off the top of your tongue is impressive. Okay.
It's part of my job. But yes. So those can be offered either within the VA healthcare system in the hospital or the CBOC, or we are now offering them through community care. So they can get a consult and referred out to see a clinical massage therapist or an acupuncturist.
Interesting. So I know that they've been doing these like trials and things, but these are now like official. Like, hey, this is what we're doing. They have really good success.
Yes. So back in 2016, the Comprehensive Addictions and Recovery Act was passed. And from that, they really pulled and identified these certain CIH modalities to be helpful and beneficial to primarily help reduce the use of opioids, and at least trying to provide alternative methods or the integrative health methods. And so NIH paired with DOD and the VHA to provide these research, to provide some evidence basis so that we can offer these modalities within the healthcare system.
Well, that's pretty awesome. I was looking at some of the materials for the whole health concept. And I thought one of them that really stood out to me was, okay, it starts with you as the veteran, and then it goes to self-care plus professional care plus community is whole health. And I was like, that makes a lot of sense. Like what matters to me may not matter to the guy next to me or the young lady next to me or the other person. Everybody has a different approach and different experiences and different requirements and different needs. Mm-hmm. And then, hey, what is it that you need? Do you need medical care? Cool. We got that. We also have community stuff. We also have, and that's what I thought was so cool about this entire concept. But how do you get that mindset? Because I've been around hospitals and the VA and other things for a long time. And I go twice a year and get my physical. And that's probably a lot of contact with the Veterans Affairs, more so than most people, I would imagine.
Yeah.
Most veterans anyway. Yeah. How do you get somebody that would really benefit from this involved?
So, you hit the pin on the head. It's the mindset. And we are striving to do a lot of outreach to veterans, but also the clinical providers within the VHA to help them understand that when we engage in these lifestyle habits and these practices, that we can, again, empower ourselves to create better, healthy foundations. It's going to take a while and a long time to work on changing those mindsets. Mm-hmm. Our overall American culture doesn't think that way. And so we are striving to each day to think of different creative ways, speaking with you even tonight, just talking about it, trying to get it out there in different ways and different avenues. One of the best ways actually to help change a person's mindset is to experience it.
Fair enough.
So, coming into a meditation class or engaging in a Tai Chi class or receiving biofeedback for the first time to help reduce chronic pain. A chiropractic visit, maybe an acupuncture visit. That's really where veterans are starting to feel the change in their body. I have a background in yoga and Ayurveda, so I really believe in connecting change through the body, the mind, and the spirit. And when you're able to coach somebody to bring attention to their body, even just their feet, they can start to notice a change in how they're feeling and how they're breathing. And just those key moments right there can really go a long way in changing a person's mindset. You're engaging them and empowering them so that they can learn to take a couple of slow, deep breaths for themselves, and they start to understand that that really does help them maybe ease some of the anxiety and calm them down a little bit. And so walking them through and then identifying with their self-care habits in their day, and then seeing what kind of changes they could make in their life.
I always thought, going back, I'm telling on myself, oh, yoga is so easy. It's like you're just sort of stretching. And then my wife dragged me to a yoga class, and it was one of those vinyasa hot yoga. And I was like, oh, this will be fun. Not really. I was wiped out. I couldn't do half the things. And it was like the most intense workout I had ever done. And I was like, wow, okay. I have a whole new appreciation for just how intense it can be without like running or lifting weights or, like things that I had always traditionally associated with working out. It was like, lifting yourself up and, the other positions. And I was like, wow, okay. You're kind of like just sort of meditating and following along. It was really kind of cool. Definitely helps with mobility and stretching and being able to do stuff. And so I became a big fan of not just yoga, but, there's other ways to do things that might really help. Biofeedback is got lots of history, and people are like, oh, it's voodoo. No, it's really just paying attention. I mean, it's giving you tools to pay attention. Same thing with chiropractors and other acupuncture. You're like, oh, it's voodoo. Well, it works, and it works for different reasons for different people, but it's really kind of cool to see how that's integrated. So you can do it at the VA, or they can refer you out, because a lot of people don't live near a big VA medical center. How does that work? What does that process look like?
So for some of the modalities, like the clinical massage and the acupuncture, you'll still need to talk to a doctor, primary care. And so they would be the ones to put in that consult referral, and it goes out to community care. Some programmings we are doing in-house. We do offer Tai Chi through the Richmond VA. A majority of all of our programming is still virtual. So there's some programs we're hoping to bring face-to-face, but majority of our classes are all done via virtual sessions.
So you like pull it up on the TV? Okay.
On your smartphone or computer. But yes, so anybody who is registered through a CBOC or your local hospital, they can access these sessions anywhere.
So I guess that leads to my next question, which is, and you sort of partially answered it, in order to take advantage of this, you do have to be registered with the VA in order to get health care.
Yes, you do need to be registered with the VA.
And that's pretty easy.
Yes. But to really engage in whole health services, so underneath our whole health hub, we have well-being groups that anybody can engage in. And you don't have to be connected to a primary care doctor yet or at all. You can engage in those well-being services as soon as you register with us. And so that's a great thing about whole health system of care, is that we are really in a place where we can offer some additional services while people and veterans are waiting to connect to other services.
So you can sort of get involved and sort of start working some of these things even as they get the doctor stuff going, which is sometimes a little, you got paperwork and you have to, especially disability ratings and all these things that may limit the access initially. Though with the PACT Act, just a shout out for the PACT Act, definitely allows a lot more people to get access to the VA for healthcare. Go check it out and go listen to the other shows. We've talked about it. It's a great program. So let's talk a little bit about the whole health program and the long-term effects. Because I was thinking, there's some big challenges that we have as veterans. Obesity and weight gain is a huge one. Now, I know this isn't directly related to that, and they have other programs, but what is the interface with, like, hey, you have this other problem and you're trying to address it, and it's like the whole long-term healthcare stuff?
Right. So again, as I said, whole health is truly a cultural transformation. So my role as a clinical director is try to integrate whole health type programming into all the other types of programs that are already taking place at the hospital.
Mm-hmm.
And so one thing, obesity rates are very high. Whole health is part of the MOVE program, which is a weight loss program that is run through the VA. And it's truly a whole health program in of itself because it's a multidisciplinary approach. You meet with a health behavior person, such as myself or a psychologist, to really talk about making lifestyle changes and connecting them to your motivation and what matters most to you. And then the next other steps within that program, you meet more specifically with a dietitian and maybe a movement specialist to help you identify more specific goals in those areas. So whole health can be, excuse me, integrated on multiple different levels within the healthcare system. I listened to a training today about how they integrated whole health through the older veterans with Parkinson's, multiple sclerosis, and just again, focusing on when you're identifying these goals in lifestyle habits, they can truly make a lifestyle and a life change for yourself immediately. And then also they can affect the longer-term health care for those veterans.
See, that's really cool. I wasn't aware that was integrated because I was checking out the MOVE program and some of the other things that are going on and how it's integrated with the primary care. And so I wasn't even aware that it's part of the whole health approach. I mean, I figured it would be because it's like very integrated and comprehensive. Like it's not just, eat less, exercise more. All right, thanks, bye. Because that's not as helpful as one would imagine. It's always tough to get started with these things. What are some of the steps to take to simplify and sort of create a plan that fits best for that veteran or somebody listening?
Sure. So, and actually, we have a tool in whole health that we call personal health inventory tool. And so right off the bat in that tool, we ask the veteran what matters most to them and help them identify their values and again, their goals in their life. And then part of that tool is we walk them through the circle of health wheel. Identified all the 8 areas of self-care, such as moving the body, the surroundings, personal development, food and drink, recharge, their relationships, spirit and soul, and power of the mind. And so we ask the veteran to identify where they're at on a scale of 0 to 5, where they are now, and then where would they like to be. And then when a veteran is working one-on-one with a health coach, they can start identifying which area they would like to start on, which feels the most closest related to their mission and their goal at that time. And then they can start identifying daily action steps that they can start making changes towards those goals.
So this inventory, is it like really like 100 pages or is it sort of like, hey, here's a, 1 to 5 of these things? What does that look like? Is it like a huge investment in time and effort for somebody to get started? Or is it sort of a quick and easy, hey, where are you and where do you want to go?
It's a quick and easy 2-page little inventory tool.
Okay, so that's totally doable. Yes.
Yeah. There's longer versions of it if you want to go into a deeper self-assessment and connection, but you can take just a few minutes to review yourself in those areas.
So I know in some of the challenges with some VA services is getting access. Yeah. I know that the MOVE program has a lot of people that want to get into it, and there's backlogs like months and sometimes 6 months or more. Yeah. What about the whole health network and getting access to those services?
You can self-refer to Whole Health today and tomorrow. Call into our office and we can get you scheduled for an Intro to Whole Health class. The Intro to Whole Health class is a 1.5 hour with a health coach. It reviews everything that we do in whole health. And then from that class, you can choose if you want to engage in a well-being group or if you want to engage in a health coach. We do not have any wait times right now because we're still fairly a new program hub at the Richmond VA. Most of our health coaches, we have 7 health coaches actually at Richmond.
So that's a good number. I mean,
yes, and we are looking to expand, but we are open.
you're open for business. And so if somebody was outside, they go to the VA or they go to their local CBOC, and how do they get started? How do they reach out and say, hey, I want to do this?
Well, I can give you our phone number if you would like.
Sure.
So the whole health phone number is 844-618-7546.
Okay.
And we do have clerks that you can call Monday through Friday, 8 to 4.
So do you have a website as well, or do they just go on Whole Health Program VA and search for it?
They can definitely go to the Whole Health, the va.wholehealth.gov website. That's going to provide a wealth of information and resources off the bat. You can probably download a personal health inventory from there and at least review what services and care is in the whole health care system. To connect specifically to Richmond services, it would be good to call that number if you're interested in connecting and learning more.
So I thought about it and I was like, what's the most important thing? Veterans have a lot of demands on their time and effort and attention. And they also have a lot of things they have in common, such as I want to get better. I want to feel better. I'm sad. I'm frustrated. I'm overweight. I'm fill in the blank. There's a lot of things that people are dealing with. Yes. So how does a veteran benefit from the VA whole health program and the support system that goes along with it? What are like the main takeaways if I'm trying to sell it in a 30-second sales pitch?
Absolutely. And I'm going to give you the voices of the veterans that have given us feedback. For whole health, it's been a game changer. They have another outlet and they're starting to see the small changes. They feel like they're going somewhere in their health. Personal health coaching helps keep me accountable and stay on track to reach my goals. They know that I'm on the right track. They're on the right road. There's still obstacles, but whole health gives them comfort. Whole health gives the veteran their voice back. Again, giving their own voice to their healthcare goals, their what matters most to them. And all we do is we provide them resources and the skills and walk them through their care for their own life.
So I like the fact that they have a lot, the veteran in this case has a lot more control over what they want to do. It's not just, hey, here's what we think you should do. Take this pill, do this thing, have this surgery. It's, I've been having some relationship problems, but I really don't need a psychologist. I just am not communicating well. And that's included. I mean, that's big. I think that's an important thing to consider because there's a whole bunch of different facets to this whole health concept than it is just, hey, here's the solution. Go see a psychologist and talk about, your problems, because that doesn't really solve the problem they're dealing with of bad communication skills or poor communication skills or whatever, So what are some of the other things? We've talked about some of the interventions and the modalities, but there's a lot more to this whole health concept than it is just, okay, there's Tai Chi and these other interventions. What are some of the things that a veteran would want to take into consideration? Like, oh, this might be a thing for me. I talked a little bit about it with the, the communication skills increases, but I'm sure there's others.
So I think veterans, when they're interested in identifying and willing to work on their own health goals, we have to be in a place where we're willing to take some time for self-reflection, build our own self-awareness, and identify what are those small action steps that I'm willing to take in my daily life so that I can improve those areas.
I like that easy little incremental steps. Today, I'm not going to do this when this happens, because you can do that pretty quickly and easily. And it's not like, hey, I'm going to lose 100 pounds. It's today I'm going to have one Coke before lunch and one after, and not two, or whatever the case might have been.
Yes. Yeah. It really is an emphasis on starting small and starting where the veteran is at. That is the core of a person-centered approach to care. And that's what whole health is. Also, it's a 101 social work, if you will, starting again where the person, the veteran is at.
Yeah, I was always sort of just thinking about like how it is for that veteran who's not necessarily in a great space. They're kind of isolated. I know a lot of people across the Commonwealth. There's a lot of non-urban areas, not even suburban in many cases, and they don't have access to that support. And there's bad habits that people fall into very easily. Drinking and drugs and all sorts of other bad things, driving fast and other activities.
Right.
How do folks that are out there get involved? I know that they can just reach out and call you and do that. And a lot of your programs are remote. Probably COVID continues. It's very effective to spread limited number of staff a long way. A lot of people can participate. It's not like, I can only fit 20 people in my classroom. I can have 40 now or 50 because, anybody who wants to log in can participate, which is awesome. I'm a huge fan of that. But at the same time, some people want to have that person-on-person connection. I want to know who I'm talking to.
Right.
How do you balance those two seeming contradictory requirements?
Right. And, you started talking about community and noticing how community is a big part of our whole health circle. And so part of our goals for the next year or so is to really start making more community partnerships, perhaps with the VSOs in the rural areas. Perhaps our health coaches can go out and visit those areas, start connecting more with veterans on a one-on-one. We are looking for creative ways of making those community partnerships.
So it's out there. It's still kind of new, and it's a whole different concept, folks. So that's the biggest thing I think is you should pay attention to. It's not just like, oh, here's another way to get to the same thing, going to the doctor. It's really a different mindset. And what do they call them? Osteopaths, the doctors that look at people more holistically than medical doctors. They're both doctors. But I have an osteopath as a doctor, and they are always amazing to me. Just, well, have you thought about this? And it's like, no, I hadn't. Maybe that's why that's causing that. As opposed to, hey, here's a pill, here's a surgery. Both are needed. They're both doctors. It's just a different approach of looking at the same problem. And that's what I think whole health is. Just, hey, here's some things you can do in addition to getting the medical treatment and the professional care that you need. But you're not on your own. I mean, you can do some things yourself, but you're not doing it by yourself. I think is that sort of the main takeaway? Things you can do by yourself, but not by yourself, or with yourself, but not by yourself.
Yes. Correct. Again, building those community partnerships, but also building the community and connection. Again, I think another cornerstone of whole health is building in the connections within the VA and outside of the VA. And one of our health coaches actually was granted some monies to build kind of a gardening program. Of course, that awesome. Is at the main Richmond hospital, but hopefully that again is, we can start at least with the community there, and then hopefully we can expand and then grow, from that. But just again, looking at many ways of how we can come into the community more.
Yeah, no, it's interesting. My wife and I go walking all the time, and at our local park, there's a community garden, and they have it locked. So only the people that have the lots, but we walk around it and see the different sections and what people are growing. And some are growing flowers or vegetables or whatever. And it's always amazing to me to watch just how much time and effort go into these and the bountiful harvest, but also the relationships that are made with the people that are participating in the gardening. They all know each other. It's, you'll see one person at the other end. Oh, hi, Bob. And that's important too. These care and these loose relationships that you may not know them well, but you know them Yeah, I don't want to go too much on a tangent, but I was doing some research the other day about relationships and how important it is for especially older folks. And they go to the grocery store and now they have all these checkouts that are automatic and that you do it yourself. And if you're kind of young and in a hurry like myself, you're great. I can just do it and I can be gone. But the older folks are losing those connections. Those, even though they're
Mhm.
loose connections, it's like the highlight of their day, which is why they go out and do that. So yeah, getting those community connections are very important, and pushing out some of these services to local folks is probably as effective or more effective than if they had to come to the VA and participate there. So they're a little closer and they're getting that connective tissue closer to home. That's pretty cool. I do like the fact that there's a lot of things on the
Yes.
VA website. It's va.gov/whole health. It's all one word. It's super easy to find. I found a number of programs that I thought were really cool that I wouldn't have thought to include in whole health, but it makes sense now that I've talked to Meghen. Things about how to make a healthy gut for a healthier you, uh, tips on eating out in grocery
Mhm.
stores, and getting to move, and forgiveness and compassion and finding balance. These sound, like, oh, these are like mental health or like nutritionist things. Well, that's sort of the concept, right? It's all these things that go into being a
Mhm.
healthier, better you.
Absolutely. I'm sure the website, I haven't done that, just talking about, because all of them focus on, again, those self-care areas that are in
Mhm.
the circle of health wheel in whole health. And it's identifying what would bring that veteran joy, identifying, trying something new, trying something different to maybe make a connection in the community. So again, anything to help improve their well-being.
So, Meghen, I've asked you a lot of things about the whole health program and sort of what it is. And so it's not just an approach. It's not just like, hey, here's this conceptual difference, but hey, here's how we're doing it at the VA and how to access it. And we've given out a lot of information about sort of just changing the mindset, um, of, and why somebody would want to get involved.
Mhm.
But I'm sure there are things that I should be asking but haven't. What else should we know?
Being open-minded,
Mhm.
just trying to step into a window for veterans and providers, all of being open-minded to this mindset change. Again, it's a cultural transformation that's going to take some time, but knowing that when you engage in your own self-care practices, and building in healthier lifestyle habits, this is larger than the VHA. This is nationwide. They've done studies nationwide and over in Europe about how to change our poor lifestyle habits. Americans have very poor lifestyle habits, and we have a very poor, um, uh, we are dying younger the majority of our other countries, and we spend the most on healthcare. And
Mhm.
so that's another reason why whole health was created within the VHA system, but it's really a study to show and empower other healthcare facilities nationwide that this is important and this is something that we all should do.
I always love talking to social workers because every time I do, they're doing something where they're filling this gap. And Megan's a social worker, and so I know that she probably agrees with me. Where people see these gaps and say, "Hey, here's how you can help yourself and get help where in the areas you need help with." And that is, I think, the most important part about the entire takeaway about whole health. It's not just like, "Hey, here's a handout. Bye." It's, hey, yeah, you do need to see your doctor. You do need to take care of this medical issues. However, here's some other things that might be really helpful in addition to the medical interventions, the Tai Chi or acupuncture or massage or whatever else it is that might have a really good outcome if you go give it a try. Yoga, for instance, a lot of people wouldn't. That's not my first line medical treatment is to go, well, yes, I'm very depressed. I'm going to go do yoga. that might work if you've done yoga your whole life and you know that it works for you. Otherwise, you'd be like, you're full of nonsense.
Mhm.
I need to go see a doctor. Well, yeah, you probably need to see a doctor, but you also should consider these other things as well. So, Megan, I know we've sort of went the width and breadth of the whole health program. It's a new program, relatively speaking. It's is it at every veteran major medical center in the VHA?
Majority of all the VHA hospitals nationwide have at least a whole health point of contact.
Hmm.
Each hospital may be at different levels of their expansion and growth of their programming.
That's fair. Yeah, I mean that's life. But pretty much, if you contact your local CBOC or your VA hospital nearby, they'll at least know what you're talking about and be able to refer you to someone that can get
Mhm.
you involved with some of these whole health programs. Is that fair?
Yes.
Okay, fair enough. So, Megan, I'll leave you with the last word. We've covered a lot. I'm a big fan. I think it is very important for folks to know about it, but also to reach out. And we'll put the website, at least the national website, on the Coming On Well Facebook and all the social media stuff. So, if you're listening to this in your car, we'll put the phone number for the Richmond VA whole health program as well. And you don't have to write it down because I'm the worst at doing that. And sometimes I'll like take a phone and my take a picture of my car so I can remember to call it later because I can't certainly write it down. Don't have to do that. We'll put it in the show notes. Megan, is there anything else we need to know, or what's the biggest takeaway you'd like to leave us with?
I think the biggest thing is, again, whole health is about you and about the person, what matters most to them, and helping them identify what kind of goals they want to work on in their life and helping them self-identify with that and making positive change.
Well, I think that's a very admirable and achievable goal. I think that's the biggest takeaway. Folks, go check it out. There's a lot of things out there. I know a lot of people would love to get involved if they knew about it. So now you're knowing about it. Uh, and the VA, lot for all the complaints people have, I've had great success with the VA. I've had the same primary care doctor since 2009 when they opened up nearby. My other medical doctor that works with the major medical center here in Charlottesville changes every 6 months. To have that sort of level of continuity, and they're just awesome. I mean, referrals and just sort of solving problems and sort of maintaining things so you don't get worse. That's awesome. It's a really good program. And just like Megan here, there's a lot of people over at the Richmond VA that just want you to be well in
Mhm.
all factors of your life. So go check them out. Go reach out and see if whole health in whole or in part is something that can help you. Megan, thank you so much for joining us on Coming Home Well.
Thank you very much for having me again.
We'll see you soon.
Thank you.
Thanks for joining us this week on Coming Home Well with Dr. Tyler Piron. If you enjoyed this episode and you'd like to help support the podcast, please share it with others, post about it on social media, or leave a rating and a review. Thanks again. And until all are home and all are well, this is Coming Home Well.